Hi everyone. Today we'll be discussing regarding a very important clinical lesion, common clinical lesion, that is schwannoma, also called as Neurilemmoma. So what is schwannoma? Schwannoma is a benign tumor of Schwann cell differentiation. What are Schwann cells? Schwann cells are a kind of a glial cells that form myelin sheath in peripheral nervous system. The Schwann cells arises from peripheral nerves. NF2 gene mutation is seen in both sporadic and familial schwannomas. So you get both sporadic as well as familial schwannomas. Both are seen in clinical practice. It can be a component of familial tumor. Very commonly, it can be associated with NF2, that is neurofibromatosis 2. Multiple schwannomas can exist, that is schwannomatosis, or it could be a part of Carney's complex, which is a kind of a multisystemic tumorous condition in which you see lots of myxomas, tumors of endocrine organ, and you get schwannomas. Important thing that is very high yielding is loss of Merlin expression, which is an NF2 gene product that is characteristically seen. So loss of Merlin is an important feature. Merlin regulates several key signaling pathways. So loss of Merlin contributes significantly towards the development of schwannomas. Grossly, schwannomas are well circumscribed lesions, usually encapsulated, generally form masses loosely attached to the involved nerve. So it can be even enucleated, it can be excised without causing damage to the underlying nerve. So that is the typical feature of schwannomas. Coming to the microscopic features, microscopically we have some typical structures, that is Antony A areas, Antony B areas. Now, what are Antony A areas? Antony A areas are the spindle cells that form intersecting fascicles. So, large number of intersecting fascicles are seen. Palisading of the nuclei. So, palisading of the nuclei is a common feature. You get parallel arrangement of the nuclei, palisading of the nuclei is seen. Central nuclear free zones are seen, that is ramified by palisading nuclei, and these are known as Verroque bodies. So, remember Verroque bodies, which are palisading of the nuclei with nuclear free zone, that is known as Verroque bodies. So nuclear free zone, then there is a palisading of nuclei, which is called as Verroque bodies. Antony B areas are hypocellular regions with spindle cells are seen, and the spindle cells are generally quite wavy as the reminiscent of the nerve fibers. Generally, the matrix is myxoid extracellular matrix, and a form of microcyst is seen. Small cystic structures may be seen. The important aspect to remember that the Schwann cell origin of these tumors confer uniform and diffuse immunoreactivity. Diffuse immunoreactivity, that is the key. Diffuse immunoreactivity is seen for S100. So S100 ISC marker is positive in case of schwannomas. Whereas if you see neurofibromas, neurofibromas will be weakly S100 positivity, diffuse positivity, uniform positivity will not be noted in neurofibroma. So that's a distinguishing feature between schwannoma and neurofibromas. So apart from these S100, you may get other positivities as well. What are the other positivities? You may have CD34 positivity, calretinin, CD56, but these are weak positivity. They are not strong uniform positivity as we get for S100. So remember, your vignettes may say S100. S100 is an important feature for schwannomas, uniform diffuse positivity. Now let's go to the microscopic picture. So here you can see the Antony A areas, the hypercellular areas, and the relative Antony B area. So this arrow reflects the Antony B area, whereas this hypercellular zone, this reflects the Antony A area. And here you can see the a kind of a palisading arrangement of the nuclei is seen, and nuclear free zone is seen. So cell free zone, nuclear free zone, and this is also seen, and there is a palisading of nuclei is seen. So nuclear free zone, palisading of the nuclei, this is known as Verroque bodies. So Verroque bodies are seen over here, and we get hypercellular zone, that is Antony A, whereas the hypocellular area with a kind of a myxoid background, that is Antony B areas. Clinical features. Now let's come to clinical feature. There is local compression of involved nerves, and there is a local structures, brainstem, spinal cord, from where the nerve arises that get compressed. The common sites where it arises are upper limbs, head and neck area. Head and neck area, the common areas include the cerebellopontine angle, CP angle we call it as. Various visceral organs, various internal visceral organs can get schwannomas. Posterior mediastinum and retroperitoneum can also have schwannomas. And the CP angle tumor, the vestibular nerve affecting tumor, that has typical characteristic features, that is tinnitus, ataxia, and hearing loss. So the constellation of all these features with the vestibular schwannoma is known as acoustic neuroma. So acoustic neuroma is a form of schwannoma which arises over the CP angle. The vestibular is also called as a vestibular schwannoma, and it causes tinnitus, ataxia, and hearing loss. Sensory nerves are also involved, and like trigeminal nerve can also be involved. It may present as a large trunk lesion, or sometimes it may be seen as a soft tissue mass. So it may be seen as a soft tissue lesion. It may form a differential of spindle shaped soft tissue lesion. So it is typically a benign lesion. Malignant transformation is exceedingly rare. So malignant transformation is much more commoner in neurofibromas, which can turn into malignant peripheral nerve sheath tumor, MPNST, whereas that is exceedingly rare in case of schwannomas. The treatment involves the surgical removal, that is curative, and often if facial nerve is involved, so facial nerve palsy may occur with the surgical removal of the tumor. That may occur in some cases. Local recurrence is uncommon. It is exceedingly rare. So that's all about the schwannoma. Hope you learned all the important aspects of schwannoma. So schwannoma is a tumor that arises from nerve sheath cells, that is Schwann cells. It is composed of Antony A areas and Antony B areas. It is having diffuse S100 positivity. The local recurrence is exceedingly less, and it is surgical removal is generally curative. It may cause localized site compression, and the vestibular schwannomas can cause tinnitus, hearing loss, that is called as acoustic neuroma. So these are certain high yield features of schwannomas. So thank you all. Thank you for the patient hearing. See you all in the next video. If you like the video, please put your valuable comments and get hooked to the channel for upcoming videos. Thank you.